Bismillahirrahmanirrahim. Today's video is very special because I will try to give the concept of seizures versus pseudo seizures, which a neurophysician comes across in clinic very frequently. So to understand, we need to know what a seizure is. So a seizure is an abnormal brain activity giving you abnormal body movements, and there could be loss of consciousness sometime, and mainly it's the involuntary movements and loss of control. Many patients who have seizures can be broadly divided into two basic categories. So the first category is the one where there is abnormal brain activity with abnormal body movements and loss of consciousness. The other category is the one where there is no abnormal brain activity. I call the second category as bodily seizures. Almost 20 to 30% of the patients who have seizures and come to the specialist center for evaluation, they tend to have bodily seizures and not the brain seizures. Also, 10% of the patients who have bodily seizures also have brain seizures, which makes it much more confusing. Many times my patient asks me this question: what are the causes of bodily seizures? So sudden event, which could be loss of family member, sudden stressor, anxiety, sudden psychological or physical trauma, like getting in an accident, or sometimes business loss, could be something which can trigger. Sometimes the past event or past psychological or physical trauma, which is not happening now, can still trigger bodily seizures, or what we call pseudo seizures. So almost, this is very commonly seen condition. It is called conversion disorder. These patients are not actually faking it, which is kind of a common concept, because it's happening at a subconscious level. So it's a wrong notion if we blame these patients that they are pretending to do what they are actually doing. Sometimes patients do ask this question, why it happens in kids? Because they're young, they can't fake it. So this is the same concept as I just narrated in my previous question. So kids, the type of stress is actually different. It could be any school-related event, or they saw someone getting punished, or it could be stress of some personality. It could be past psychological or physical trauma as well, which can trigger event in kids. But again, they are better responders in terms of the treatment, and they tend to improve more as compared to adults. There's a question: how can we sure that this is a true seizure or this is a bodily seizure? So the best way to confirm is video EEG, which is a brainwave testing. There are multiple leads applied to the head, and then you do the brain activity testing. And if during that event, patient had an event which is in question, it gives you almost 100% confirmation of the nature of the event. But if patient didn't have that actual event during the study, then it is hard to say. And in that case, if a patient have true seizures or brain seizures, in 25 to 30% of the cases you can tell based on the signature changes on the EEG. Patients also say, were their previous doctor incompetent because they started the patient on anti-epileptic or seizure medicine? I will usually tell my patients they are not incompetent. It's mainly with the fear because the seizures can cause brain damage and they are not sure. So to be on the cautionary side, they started the seizure medicine, which is actually not a wrong approach. But naturally, to really confirm the diagnosis is the key component in these patients. But don't consider those doctors they are incompetent in any way. It is also noted that almost 80% of the patients who are treated with seizure medicine, at some point, they tend to have the bodily seizures and not true seizures. So it's, as I said, it's not wrong for some patient to be on the medicine, to be on the caution side, and it's not unusual at all. There's a sometimes question why EEG is normal in patient with who has true brain seizures. As I just mentioned, it is normal EEG in almost 65 to 70% of the patients, and only 25 to 30% of the patients have changes on the EEG or electroencephalography. But again, if a patient had an event during the study, the chances of knowing the nature of event goes up to 100%. Patients do ask, doctor, am I going crazy by having this diagnosis of psychogenic or bodily seizures? I usually tell them, see, this is not that you're getting crazy, it's more of a social dilemma or social taboo. But as a matter of fact, It's just you're not able to manage stress, and it's just like somebody has a fever and it's not being controlled with just sponging and taking care in general or drinking plenty of water. So they need a paracetamol or some medication to control their fever. So similarly, they need to see a psychiatrist or a psychotherapist to help them control their psychiatric manifestations of bodily symptoms. What I usually tell my patients is that I consider a human being a combination of three beings. One is the physical being, which is sitting in front of you. One is the psychological being, which is what's going on in my head. And the third one is the spiritual being. So for the physical problem, like for headaches and brain seizures, you do see a neurologist. For your subconscious issues or anxiety and depression, you see a psychiatrist. And if you feel there is issues with the spiritual being, then you should see a spiritual healer, which could be a priest, which could be a Maulvi, or anyone you can see who can guide you and let you handle that part. So keeping the balance between the three is the key, and yes, it is very hard to keep the balance, but we all try to. I usually tell my patients, see, it has to be you who has to beat the condition and improve. We can all guide, like a neurologist, psychiatrist, spiritual healer, we can all guide, give you medicine, but it's you who has to beat the condition and come out of it. And that is actually possible with the help of the family support and with your strong being self. The most important advice I like to give to the family members of patients with epilepsy or seizures is that if a patient has a seizure in front of you, put them in a safe environment so they may not get hurt. Try to make a video of their face and the body, and that video is actually very helpful in terms of making a diagnosis. And lastly, if a patient had a seizure and you want to get a consultation, do bring all the record, including previous MRI, CT scan, EEG, whatever you can grab on, and bring it to the doctor's office. So it will help the doctor to make the decision, and it will help the patient in the end. I hope this video will be helpful for patients who are having seizures, either it is bodily seizures or brain seizures. Thank you very much.